If you steam, boil, fry, or whatever else it is that you people do to your vagina, if you have unprotected sex or multiple sexual partners, if you what else? If you insert pearls, uni pearls, and whatever, what are those things called? Because I don't even know. Whatever it is that you could do, if you insert anything, steam, frying, whatever it is you do to your vagina, you're just putting yourself at risk of vaginal infections. Hi guys, welcome back to my channel. My name is Ade. If this is your first time here, and thanks so much for dropping by. This is not your first time, you guys already know I love you. And yeah, I make videos around relationships, love, and lifestyle, and every now and then, like today, I make videos around health, seeing as I am a medical doctor. Yeah, and I'm currently living in Akure, Ondo State. So in the last few weeks, I've had several questions from people both within the hospital and outside the hospital. That is my patients in the hospital and just friends, acquaintances outside the hospital. And these questions I've been getting, I've got me thinking perhaps abnormal vaginal discharge is one of the top complaints of women of childbearing or reproductive age, because like in these past few weeks it has been really a lot. And that is to say, and that is even considering the fact that so many people would not like want to tell anybody about when they're having discharges that they think are abnormal, or when they're having any issues with their private parts in that sense. So most people are like not likely to talk, especially if it's not like a female doctor. They won't want to like talk. So considering that I got this much that much complaints from people, I'm starting to think maybe this is quite a common topic, and I decided to address it. I hope I make sense with all my rambling. I also have to say that there are several hygienic practices or unhygienic practices rather that will put you at risk of vaginal infections and pelvic infections, which can cause abnormal vaginal discharge. If you practice douching, if you steam, boil, fry, or whatever else it is that you people do to your vagina, if you have unprotected sex or multiple sexual partners, if you what else? If you insert pearls, uni pearls, and whatever, what are those things called? Because I don't even know. Whatever it is that you could do, if you insert anything, steam, frying, whatever it is you do to your vagina, you're just putting yourself at risk of vaginal infections. I've mentioned in the last video when I talked about hygienic practices or that all females should know. So I'll put up the link in this video. So hygienic practices that all females should know. In that video I mentioned that the vagina is self-cleansing, so you don't need to insert anything into it to clean it. And please, let's help ourselves, because the truth is I realized that amongst these patients that have come to complain, most of them actually do have unhygienic practices. A lot of them confirm that they usually steam, or they usually wash with they always clean with Savlon, they always wash with this and wash with that. And see, sometimes I get tired, but now the work where they do, I can't stop talking about it. So so a lot of people agree that they do have unhygienic practices. They have either multiple sexual partners or unprotected sexual intercourse with people whose statuses they don't know. Do you understand? Or people who possibly have multiple sexual partners. So all these things just put you at risk. Like, are you not tired? Are you not tired of treating vaginal infection every, like there was a particular case I saw and I was starting to wonder, like, this is not normal. This is not normal unless you're immunocompromised, meaning maybe you have tuberculosis, HIV, diabetes or something. You shouldn't be having vaginal infections and keep treating it like every 3 weeks or every 4 weeks. Like, what is it? So I had to ask, like, this is not normal. Do you understand? So please, let's make sure that we what they call in English we pick up healthy habits. Do you understand? Yes, the vulva needs to be washed, but with mouth soap it's fine. but you don't need to insert anything. When the normal flora, as they call it, is now stripped off or distorted, it now makes it easier for harmful bacteria to just flourish there. Do you understand? So yeah, I think that is what I wanted to put out there. So so many people have issues knowing when a vaginal discharge is abnormal. I would like to say that there are normal vaginal discharges, so not all discharges are abnormal. So at certain times during your menstrual cycle, it's possible to see clear watery discharges. Do you understand? And also when you're ovulating, you tend to get like this stretchy, clear, or maybe slightly off-white, milky, or do you understand, milky discharges, which can be normal. But and also, yeah, when you are aroused during sexual foreplay or whatever it is, it's possible to get like clear discharges as well, which are sticky or stretchy or whatever it is you call it. But there are things to look out for so when a discharge is abnormal, or knowing when you should see the doctor. Do you understand? So first is, are you having vaginal itching along with these discharges? If you're having itching around the vulva or vagina, then obviously something is not right. Do you understand? So vaginal itching is number one. Foul smell. Now, regardless of how the discharge looks, if it smells bad, then most likely it is bad. So I mean, the normal discharge females have, when you perceive it, it shouldn't be like, do you understand? Your closure shouldn't be like, what is this? Do you understand? It should have a smell, or maybe odorless, but the smell shouldn't be offensive. So if the smell is offensive, then something is definitely wrong. Also, if the discharge is lumpy, so I mentioned that milky discharge can be normal, but if the discharge is lumpy, like so it clumps like cheese, you know when you put cheese in water, so it clumps up like tiny whitish cord-like things, that's definitely not normal. That looks like candidiasis, so you should see your doctor. Now, if the discharge is colored, I mentioned that milky can be normal, but if you're having like brownish discharge, so if the color is off, like it seems off, you're having greenish discharge, you're having whitish discharge, there's foul smelling, you're having brownish discharge, and it's not like your period just ended, do you understand? Then you definitely need to see your doctor. If you have fever along with these discharges, or if you have abdominal pain like in the pelvic area, then definitely this is not normal. You need to see your doctor. So there's also something I forgot to mention earlier. In pregnancy as well, there's what we call leukorrhea of pregnancy. So where there's this increased vaginal discharges, which is completely normal, nothing to worry about. I see a lot of pregnant women worry about it, and something they have candidiasis and start complaining to the doctor on several occasions. You don't need to be treated for that. Leukorrhea of pregnancy is completely normal and it can be cool. So this is copious, like it's a lot of discharge, but it's not foul smelling, no itching, and nothing like that. It is completely normal in pregnancy. And yeah, I hope with all I have said, I have made sense to you. People should help me to help you. Yes, help us to help you, meaning help we doctors to help you. The things that can be avoided, let's avoid them. Do you understand? There's certain things that we don't need to be treating. We don't need, this 2020, whenever entering 2021, we don't need to be talking about certain things. Do you understand? As you get older, you should learn to take charge of your health as a lady. You should learn to take care of yourself. Do you understand? Take care of yourself. And yeah, I love you guys, and if you have questions, be sure to leave it in the comment section below, or you can send me a private message on Instagram or to my mail. I'll be glad to answer them. And yeah, I'll see you guys in my next video. If you also have video suggestions, you can comment as well. I'll be sure to respond to them. And yeah, like and subscribe if you haven't, and yeah, I'll see you guys in my next video. And I hope all this is recording because my phone is acting up. I'll see you guys later. Bye.